Thank you, Leah, and thank you to the organizers for inviting CIHR to participate. I really enjoyed the morning session. There was lots of stuff that was interest to us. I want to take back all the slides that people presented to the Partners and Citizen Engagement branch at CIHR because they need to see it. The head of that branch, his name is Drew Lyle. He's a fantastic, energetic individual who I'd like for you all to get to know. Unfortunately, he's not well right now, so I'm Drew's stand-in. That's why I'm here today instead of Drew. The second thing is, just to start out, David actually stole my talk by saying that partnerships is like a dating service. And it's true, that's what we are. We run a matchmaking service, basically. That's a lot of what we do. I did want to point out a big difference between the United States model that you heard this morning, and David, you actually asked that question about the role of a foundation. So should there be a foundation as an interface between government funding and private partners? And CIHR has had extended discussions about this, and we actually don't work under the same rules and regulations as the NIH. And after those extended discussions, we have decided not to go the foundation route. I think part of it is that scientific directors like me want control and don't want to cede control. A more positive way of saying it is we want to stay actively engaged in the conversation. So the other difference about CIHR from NIH is we cover a much broader mandate. We are about discovery research, we're about patient-based research, but we're also about health systems delivery research. Canadians are very proud of the healthcare system we have, and we need to support it in a cost-effective manner. And we're about pop health. So we're about primary prevention as well as secondary prevention, disease management. So we are mandated, and that's why I'm really keen to hear next year's workshop on knowledge translation and exchange, because that totally fits within our mandate area. So CIHR has values in its roadmap. This is our strategic plan. I wouldn't read it because there's a new one coming out in about a month's time, and you might as well read that. It's a refresh because we realize the world doesn't work, the research world doesn't work in 5-year cycles, so we're going to extend it out for 10 years. And the value, number one, is excellence. We do not have any intramural funding. It's all extramural funding. $1 billion a year is the budget of CIHR, roughly speaking. And one of the things that's on the right-hand side, but expanded, is about collaboration, that we are about partnerships, working to fulfill our mandate, collaborating with domestic and international partners. I mean, in the real scope of things, Canada is a teeny tiny country, population size, and we do punch above our weight for research dollars on outputs, but we need to do more by working internationally. So we count partnerships with colleagues in government like Health Canada and Public Health Agency of Canada. We count partnerships with the charities. We count partnerships with industry. You'll see, I think it's the next slide, within local institutions, that the part we haven't done that well with is the private. That's the green line below. And most of the private fund partnerships dollars at CIHR over the years have been with RX&D, big pharma, and not with a lot of other what are called non-traditional partners. And I do take the point from this morning that there's lots of time required to build these things. You don't build a funding arrangement out of scratch. You have to build relationships. And part of our model doesn't work in sustaining those relationships because jobs like mine are not lifelong jobs. They're term-limited positions. So there's a turnover, which means new ideas, but it also means you lose a bit of the continuity. The other part about the private sector is that many companies are represented in Canada, but decisions are made somewhere else. And that's why we really need to be engaged on a global stage, not a Canadian stage. And Eric and ILSI North America has been terrific in helping us build those bridges on behalf of Canadians. So if we can make you an honorary Canadian, Eric and Sherman, we need to, because you guys have been really supportive of a much smaller size of group that you're used to dealing with in the United States. And we certainly value the input you've provided us. So this is a different slide, but it really is describing what you already heard from our colleagues in the United States. First, you got to identify a need, and we run CIHR, we run gaps, workshops where we talk about gaps. Where are the areas where we should put dollars? And we don't develop partnerships until we identify the need. And that, I think the word you used was justification, but it's the same idea. And then to get those wheels moving in synchrony, the cogs not clashing, that's the part about building trust and having a long working relationship. And it's not weeks or months. It's like you said, it's about years to make this happen. We value financial partnerships. Boy, do we value financial partnerships. But that's not all. There are certainly in-kind contributions that are very valuable. There is a debate, and I was discussing with some folks at lunch. There are folks, including politicians, who very much like the model of investigators coming with partners to get funding from the federal government. And what I hear loud and clear from researchers is, you come up with the partners, and then we'll apply for the funding. So there are two models at the table that are not exactly the same. And there is a difference of opinion, is all I can tell you at CIHR, on what's the best model to approach in that regard. We run on a bigger is better, more impactful model, realizing that diversity is also a very valuable contribution. But CIHR is trying to launch bigger proposals in a variety of areas, from basic fundamental discoveries, inflammation and chronic disease, to impact on patient health, the strategy on patient-oriented research. So there's a series of programs that are coming up. They're often based on this idea of transdisciplinary across university research team grants, or themes of grants that you heard from the dairy farmers, programmatic grants that we do try to launch. So one example is the strategy on patient-oriented research. One network is about to launch, a second one is close behind, and at least 4 more are coming down the pipe very quickly. They're big grants by Canadian standards. Just for our American colleagues, their salaries aren't included in these. These are operating dollars. So they're matched funding. So here's a partnership required in advance of funding. $12.5 million from CIHR. If it's matched from a partner, it could be a province in the support units, could be a foundation. Graham Beck's interested in mental health. And this is a two-way street. We don't dictate the rules. In fact, the gap that was identified was mental health. The Graham Beck Foundation said we're in and partnering, but it's on child and youth mental health. So they narrowed the focus, which I think is a very smart thing to do because there's more impact. Now, it means you're not including all areas of mental health, but trying to be impactful. And so this is a model that's about to be launched. The competition has been run, and we're looking to do this in our mandate area as well. There are partnerships for health services improvements. This is a smaller idea of partnering, usually with decision makers. That could be a hospital decision maker, a health services provincial or territorial decision maker. And one example that's funded in this area is Dr. Bull, who's at the meeting, I saw him in the program anyways, from the University of Alberta, on working with parents to prevent childhood obesity, primary care. So primary care, very important, because that's how the Canadian healthcare system runs. Primary prevention, very important. Childhood obesity, extremely important. So you're going to look at a study on impact. This is one. I was asked also earlier today about interdisciplinary research with the social sciences and with the fundamental sciences covered by NSERC. And yes, we want to work in that space. There's lots of exciting stuff going on in that area. And you heard about the CRD program, which we have been involved with, and funding sodium reduction research, and a bigger kind of research program through the collaborative health research projects. This one does require partnerships as well, so that's part of the issue. We have funded with smaller societies, and I hope the Canadian Nutrition Society doesn't take any offense by being characterized as a smaller society, but we can make your dollars go farther. The CNS has funded individuals across the country, including here at Memorial University, on nutrition-based research. It's taking partners in industry, working with a professional society, and working through CIHR. At the time, it was through this program called Small Health Organization Partnership Program. It's been sunsetted. or retired, whatever word you like to use, but there are opportunities for CNS and its membership to become involved in partnering with CIHR through a variety of programs. And one of the ways to do that is through the 13 virtual institutes at CIHR. One of those 13 virtual institutes is called Nutrition, Metabolism, Diabetes. So, geez, I hope you guys get our newsletter. If you don't, please sign up. You can unsubscribe very easily. There's a way to do that. But it doesn't mean we're the only institute that you guys should be looking for research funding opportunities. Circulatory respiratory health, totally in our area. People and Population Health Institute, totally interested in this mandate area as well. So there are multiple institutes interested in supporting the kind of ideas that your society and you as individuals are interested in. Our Strat Plan is published, and for some of those, I've heard the word food and health mentioned quite a few times today. Together with partners, multiple partners, which includes charities, medical professional societies, and our colleagues at Health Canada and Public Health Agency. This was our strategic plan, and you see number 1 up there is food and health. So we had a discussion at a workshop about whether Canada should have a food and health national strategy. The Conference Board of Canada is quite interested in that. The politicians are semi-interested in it, but I think it's something for the organization to think about. There are other areas that are definitely related to nutrition, and that includes the environment and its impact on the microbiome, for example, the diet impact on microbiome, and genes and how they impact on chronic polygenic disorders. Obesity and healthy body weight, seeking solutions. This is a more translational type research program, but if you follow along in what we're doing, we launched an obesity research program that included evaluation of outcomes following bariatric surgery, but also understanding basic mechanisms underlying bariatric care interventions. So we cover the continuum of care. And we are refreshing our strategic plan now. It's not been finalized, but what I can tell you is it will continue on in these themes. We know there's more to do. One of the areas I heard, and I apologize because I don't remember, but people mentioned, I think it was our seal industry colleague who mentioned food security. So food security is a global issue, a huge global issue, identified by the World Health Organization as the #1 human health issue for the 21st century. If you don't believe the WHO, and many don't, it's the lead issue of National Geographic, Food and Health. So there's a reputable source. Not saying WHO isn't reputable, but National Geographic has also identified food and food security as really critical. And sad to say, food security is a big issue in Canada. It relates to certain vulnerable populations, and especially in the north. So Health Canada, Hassan, you've launched a issue about food security in the north. There's some research objectives identified there, and I think we have a lot to do for our folks who live north of 60. So food security is on the agenda, including in developed countries like Canada. So in food and health, we have moved on these various areas. And as I mentioned, it includes biomarkers of nutrition that we've launched with the countries of the European Union, and we are looking for food security. But what we've done so far, and what's going to be highlighted at the meeting, I guess on Saturday, if I got it right, is we have launched large programmatic grants, bringing teams together from across the country, including young investigators, so it's not just the old guys, senior people getting supported. The principal investigators are listed here. I guess you can see them all there. I'm not quite sure if they're all listed. Various aspects of nutrition, going from basic to more translational, and you can see that they're across various parts of the country, and there's multiple co-investigators included. So it's a $10 million funding in partnership with industry, one industry in particular, with the one start at the top. They've just started, so we're hearing how things are going at a private workshop tomorrow. We'll publicize how we're doing on Saturday, and we'll keep you posted as things go on, because I think there's opportunity to build on this. To me, this is the start of an enterprise on food and health, not the completion of it. We can fund with partners who bring money to the table we can facilitate going national. So this was a BC-based foundation that wanted to run pediatric IBD across the country. We were able to facilitate that and provide the peer review for the process. And the check, I don't know if you can read it, was for $5 million. We were also very involved in the governance, that is milestones. The one thing that you have to realize as a researcher, with these big amounts of money comes more obligations. And that's going to include more reporting and having the partners involved in knowing, are you meeting the milestones? Have you met enough to get the next set of dollars? The idea that you'll get a $5 million check and report back at the end of 5 years, those days are long gone. Funders, including federal funders, want more information. We can also partner via organizations like the charities and the medical professional societies through agriculture, the food industry, and big pharma. We have very good examples. I showed you the one with the CNS through the SHOP program. We have a great collaboration with industry through the Canadian Association of Gastroenterology that includes fellowships, new investigator awards, and operating grants. Now, Leah, you asked about measuring outcome. So we are all about measuring outcomes, short, medium, and long term. And we need to do this for all of CIHR. But what we did is for this one little program, we used CIHR resources to assess how we had done. And it's published in the Canadian Journal of Gastro, so you can have a look at it. So this funded research capacity in the country. That was the intent of the program. It funded tons of important high priority articles. It doubled the dollars that were spent. The folks who were funded to do research stayed in research. But the unanticipated benefit, which industry hadn't put on the table as a criteria, which we hadn't set as a criteria, but when we asked, there were lots of patents. So there are basic discoveries that have potential for commercialization value and are of interest to small and medium enterprises in Canada and venture capitalists in the United States. So sometimes you hit a broader target than you're really looking for. And long term, we want to know about whether this research has had an impact on healthcare systems and on human health. And so these are short-term measures to continue to evaluate down the long term. So looking ahead, we seek to fund with partners. We are keen on non-traditional partners. We are not using the foundation model as I described to you. We have lots of funding, strategic funding opportunities aligned with the members of the Canadian Nutrition Society. I must say the members of Canadian Nutrition Society is already a powerful group. You know that there's a grant panel that relates to nutrition. There are many Canada research chairs across the country held in various aspects of nutrition. But areas that are being announced now are team grants in bariatric care. So if that's in your bailiwick or some of your colleagues, talk to Mary Jo or me for details. And we are about to launch programmatic grants in environments, genes, and chronic disease. And again, we'll happy to provide you with more details. So with that, I'll conclude. If you want more information, you want to sign up for our newsletter, please talk to me in the break. And with that, I'll conclude, and thank you very much for your attention.